Thank you. Let's move on. The honourable member for Innisfail, Sylvan Lake, followed by Edmonton Riverview.
More.
Mr. Speaker, there seems to be a lot of confusion, so I'm just going to make it a little simpler here. A senior in my riding was recently told that she needed immediate shoulder surgery. If not done, it would cause irreparable damage to her shoulder. Active. Booking for surgery was a ridiculous 3-year wait. So instead, she took her health care into her own hands and she booked her surgery in BC. The cost of that surgery, $17,000 out of her own pocket. AHS cost, she went to the committee, $980 reimbursement. Minister, please help me understand so I can explain to my constituents how you can justify paying for Alberta Health executives who clearly jumped the queue, and yet Albertans have to do so many.
Honourable.
Well, Mr. Speaker, no one has proven that any Alberta Health Services executive since this government took office has jumped the queue, and to suggest so on the basis of a receipt tabled in the House is simply not accurate. Mr. Speaker, what the honourable member should know is that the out-of-country Health Services Committee program is administered by a separate committee independent of government, Mr. Speaker. If the honourable member wants to make a direct connection between her question and her constituent's problem, I'd be pleased to look into it. If she wants to falsely connect it to other allegations that have been made in the House earlier today, I can't help her, Mr. Speaker.
Honourable member.
Well, luckily for us, Albertans have the ability to read. Given that we have already heard of 2 families in serious need of life-threatening health care that was not offered in Alberta and they were denied, and given that this Alberta Health Services executive billed taxpayers for this private diagnostic service in December of 2011, left AHS in January of 2012, and received over $400,000 in severance, doesn't the minister understand that Albertans will not see this as fair?
Well, Mr. Speaker, this is the typical non sequitur that we hear in the questions that have been offered by this member earlier this week. Mr. Speaker, we've dealt with the issue that was raised at the beginning of question period with respect to the expense claim in question. If the honourable member wants to help her constituent, Mr. Speaker, one thing she could do is to inform her constituent of the process that is available to recoup health expenses that are provided out of province or out of country. Mr. Speaker, this program is administered independently of government, and Mr. Speaker, the insured services that are provided in BC would not be provided in Alberta because this government stands up for public health care.
Honourable member for Airdrie, you rose on a point of order at 2:11 p.m. During the minister's first answer, and we'll note that later. Honourable member, final question.
We helped her with that process, and you kindly gave her back $980. Given that this minister continues to insist that there is a fair process for approving these out-of-province claims, and given that Alberta Health Services executives don't have to go before the same committees that Albertans do, will this government not agree? The process is not working. Create a policy that allows all Albertans to obtain health coverage even when treatment is not offered in Alberta or exceeds the excessive wait times that are currently the case.
Well, Mr. Speaker, as was indicated in answers and estimates last evening for the Department of Health, we know that over 12,000 Albertans received financial support for out-of-province and out-of-country health services last year. Mr. Speaker, we regularly provide this level of support. It is based on physician adjudication of patient need and circumstance, not the adjudication of ministers or elected members of the House. Mr. Speaker, there's an appeal process that's available for people that are unhappy with the decision they receive from the committee, and Mr. Speaker, will continue to provide funding to support this program to get Albertans access to the services